Let's talk about titrating medications. It's something that is going to be very common in your practice as a nurse, especially if you're going to be in critical care areas or emergency care areas. So let's talk about that process, and I'm going to give you some of my best tips so you feel more comfortable and confident when it comes to managing these types of medications. So if you're new to titrating and weaning medications, it can be quite overwhelming when you first start doing it. So you should have some practice while you're in orientation, but as we all know, you don't get everything while you're in orientation. So I wanted to just go over the process of weaning and titrating some of the medications that you may experience or encounter in your practice. The very first tip that I'm going to go over is be patient with yourself. Understanding and knowing and trusting your own nursing judgment around the weaning and titration of medications is truly a skill. And if you're new to this skill, you may not be completely confident in your own nursing judgment to make those changes yet. And that's okay. With time and practicing this skill, you will start to develop more confidence and trust your own nursing judgment around making those changes based on your order. My second tip is to have a baseline knowledge around the medications that you will be expected to know how to wean and titrate based on an order. Some general knowledge around what the medication is, what it's called, what the mechanism of action is, what the appropriate response would be, side effects, and normal ranges is something that will definitely help you in the beginning, but also help you feel confidently related to your nursing judgment around making those decisions to wean and titrate the medication in general. I put together a resource on the most common medications that you may be expected to know when it comes to weaning and titrating those medications. I will have a link to that resource in the video description below. My third tip, and this is a very important one, is to know your order. Your order is what is going to dictate what you can and cannot do and will help guide you on your nursing judgment around making those decisions of what to do with the medication. So your order is also going to be just a really good reference point in case you're completely unfamiliar with what to do. There are going to be 5 main things that your medication order should have. Number 1, it should have a starting dose for what you're going to initiate the medication at. Number 2, it is going to have a maximum amount of what the medication can be running at, so a max dose. Number 3, it is going to have the amount that you can titrate by with each titration. Number 4, it's going to have the frequency of which you can make those titrations. And number 5, it is going to have a goal parameter of what you're actually going to be looking at to make those titrations or weaning the medication. An example of this would be Levophed. Levophed is a very potent vasoconstrictor. We utilize it a lot in the ICU as well as emergency departments to support our patients' blood pressure if they are hypotensive. A norepinephrine order may look something like this. Initiate dose at 5 mics a minute. Titrate by 2 mics a minute every 2 minutes for a max dose of 80 mics a minute for a MAP of 65 to 75. So as you can see, that order gives you a lot of guidance of what you can, when you should, what to do with the medication itself. So definitely lean on that to help you make those adjustments to the medication itself. My fourth tip is going to be make sure that you are assessing and reassessing. That is one of the biggest things that we have to do with titratable medications. We don't just make a change and then just kind of let it go. We have to make that change, see if the change was effective, and then make additional changes if it wasn't, or just leave it be if it was. With patients that are on titratable medications, we are continuously going to be doing that assessment, reassessment, and manipulation of that medication. So for the example that I used, say my patient's mean arterial blood pressure was 55. Well, I'm going to go up on that medication by the order, so by 2 mics, and then I'm going to reassess. Did I meet the goal parameter of 65 to 70 for the goal, the mean arterial goal of 65 to 70, or did I not? If I met that parameter, then I'm just going to leave the drip exactly where it is. If I didn't meet that parameter, then I'm going to go up again. And you would do the same thing if you were over that parameter. Say my mean arterial blood pressure was 85 at this point. Our patient is recovering, they've been resuscitated, they're starting to look better. So they don't need as much of that vasoactive medication. So we can start weaning that medication down. Their mean arterial blood pressure is, like I said, 80, 85. So I know that I can start to come down on that medication because they are above the goal range of the order. So what that means is I'm slowly going to start weaning that medication down until I meet that goal parameter. But all of that takes place by making adjustments, assessing, reassessment, 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 make adjustments. You may go up and down. It just depends on what's going on with your patient. And the very last tip that I want to share is if you're uncomfortable, phone a friend. That is always going to be the baseline, right? So if you don't know, if you're not quite sure, if you need a second set of eyes, if you just want to kind of validate what you're going to be doing, always phone a friend and bounce that idea off of somebody else that you trust. Something that we have to remember is that if you're unsure, it is totally okay to ask for help or another set of eyes. It does not matter how experienced you are or how many times that you've seen this. We're all human, and sometimes we just need that set of second eyes or that person to validate what we're doing. Seriously, this is like, even though we may have our own individual patient assignments, when it comes to taking care of critically ill patients, we really do it as a team effort. So there you have it. Those are my 5 top tips to feel more comfortable and confident when it comes to weaning and titration of medications that you may see as an ICU nurse. Like I said, don't forget to grab the resource that I made for you on the most common medications that you may see in critical care areas by visiting the link in the video description below. And also don't forget to subscribe and give me a thumbs up if this video was helpful for you. Until next time.